The other movement about the wrist joint or the radiocarpal joint is radial and ulnar deviation. So radial deviation is what we're going to look at here. Radial deviation occurs in the frontal plane. So here's the plane, and it is about the anterior posterior axis. And it is when the thumb or the hand moves towards the thumb side. Now, the thing to remember for radial deviation and ulnar deviation, let's get this back in here, is that it is the muscles that are, oops, sorry. The muscles responsible for that motion are attached on that side, right? So the muscles come down, they attach it near the thumb, and when they contract, they pull the thumb, the hand towards the thumb or the radial side. All right, so what are those muscles that are on that radial side? We have extensor carpi radialis brevis, extensor carpi radialis longus, and flexor carpi radialis. So this image is a cross section of our the carpal joint or the wrist joint, sorry, at the level of the carpals. And you can see here's the AP axis and the medial lateral axis. So if we're on the lateral side or the radial side, it is both of these, both the flexor and the extensor compartment can pull our wrist toward the radial side. So we said before we have the flexor carpi radialis, the extensor carpi radialis longus, and the extensor carpi radialis brevis. So just to review, we have the extensor carpi radialis brevis. Remember, the extensors come off the lateral epicondyle, and they're all radial nerve innervation, and it contributes to radial deviation because it's on the radial side. Extensor carpi radialis longus, again, radial deviation, lateral epicondyle, and radial nerve innervation. And then finally, we have the flexor carpi radialis. So everything with radialis seems to be a radial deviator. It is coming off the medial epicondyle because it is a flexor, and it's median nerve innervation. So those are the three muscles that do radial deviation.